Good day to everyone. Welcome to the virtual orientation regarding the MCCOD assessment in health facilities as part of the DOH Data Collect Hub. I am Micah Galat, Development Management Officer 3 of the Health Facility Development Bureau. This presentation shall provide an overview of the MCCOD assessment process and reporting in health facilities and sharing of links to MCCOD assessment-related resources, materials, as well as the e-learning module. The flow of discussion would be as follows. First is to present the background on the MCCOD initiative, which includes several policies and issuances. Then a short introduction of the e-learning module on MCCOD assessment. And at the end of the presentation, we shall provide links to MCCOD assessment-related resources and materials. First, I would like to provide an overview of MCCOD assessment in health facilities, which includes the policies relative to the initiative. On August 20, 2015, Proclamation number 1106 was passed, declaring 2015 to 2024 as the Philippine Civil Registration and Vital Statistics Decade, and enjoining all agencies and instrumentalities of the national government and local government units to actively support programs relevant to the Get Every Pinoy and Pinay in the Picture initiative. The Department of Health, guided by Formula 1 Plus for Health, issues this Administrative Order number 2020-0008 to establish procedures and to define roles and responsibilities for reporting, certification, and the review of cause of death. In support of these and to establish the continuous improvement of mortality data, specifically cause of death statistics among hospitals, HFDB issued DC number 2022-0293 to standardize the process of MCCOD assessment and reporting. The establishment of the system is part of the continuous quality improvement of HHIM in providing quality health records and reliable data for health facility planning and decision-making. Hence, to institutionalize the process of MCCOD assessment in health facilities and utilize the data towards improving the quality of the death certification, an offline Excel tool introduced during the trainings for the past years and was used by the health facilities on the pre-training and post-training assessment is transformed into an electronic MCCOD assessment module embedded in the DOH Data Collect Hub. The contents and categories being checked are the same as the offline Excel tool, only that the system was streamlined for the easy and fast encoding, generation, and analysis of submissions. The DOH Data Collect Hub, where the module was lodged, is the same system used by the hospitals in the submission of other modules like the pharmacy module, the nursing module, the quality module, the infection prevention and control module, and the public health unit module. This is to come up with one platform that monitors the supply of health facilities and the quality of health services. A separate account credential shall be used by the health facilities to log in to the MCCOD assessment module. The implementation of DC number 2022-0293 shall follow the prescribed timeline. Third quarter of 2022 is for policy dissemination and capacity building through the DOH Academy e-learning platform. Staff involved in health facilities and the CHD-HFDUs shall take this course, which may serve as an orientation on the process of MCCOD assessment, reporting, and submission. Implementation of the department circular or the start of death certificate assessment shall be from October to December of 2022. Hence, only death certificates generated for these months shall be included in the report. The rest of the data needed in the module, like the trainings and policies at the health facility level, shall be reported as is. Starting 2023, implementation covers death certificate assessment for the whole year. from January to December 2023. The following are the steps, activities, and expected outputs on the MCCOD assessment process. The health facilities are expected to do the sampling, the actual assessment of death certificates, and the encoding of the assessment report. The CHD-HFDU in the monitoring of submissions, and the DOH Central Office in the analysis of data. With all these, the HFDB in coordination with KMITS developed an e-learning module which serves to orient the health facilities, especially the hospital health information management staff, on the standard process of assessment and submission of reports utilizing the DOH Data Collect Hub. This will also guide them, including the HFDUs in the implementation of the DC number 2022-0293 or the interim guidelines on the assessment of MCCOD in health facilities. The developed e-learning module can be accessed in the DOH Academy as an open access course at learn.doh.gov.ph. As mentioned, the e-learning module can be accessed in the DOH Academy. The module is divided into two parts. Module 1 focuses on providing an overview of death certificate assessment and the criteria based on international standards. Module 2 focuses on the MCCOD assessment process and reporting based on the DC number 2022-0293. Finally, we share with you these reference materials in relation to MCCOD assessment in health facilities for further information. On the right are the links to the materials listed. For technical assistance, please contact the Knowledge Management and Information Technology Service for queries regarding the overall MCCOD program, including training of physicians and the DOH Data Collect Hub concerns for the MCCOD assessment module, and the Health Facility Development Bureau for queries or clarifications regarding the overall MCCOD assessment process and reporting, including the e-learning module through the contact details provided. To end the presentation, we would also like to share the FAQs slide deck for health facilities through the link provided. This is a working document that will be updated from time to time to account for all inquiries received. That ends my presentation. Thank you.